This is another case. I received a telephone call from the United States from a doctor. It says, we have heard that you are the greatest, the biggest, and all this. And we have a case of cancer of the lungs, of the lung. And he's a very important person, and we would like to bring you over there. I said, sorry, I cannot take a cancer case. But this and that, anyhow, he forced me. He said, we know that this is the only chance the man has, and you have to accept him, and there is no problem. And anyhow, he talked me into taking the case finally. I said, okay, if it is like that, you come. So the patient who was born 39 and is 81, it is 42 years old. The patient is 42 years old. And this is one of the reasons I said, okay, bring him. He's a young man, and maybe his vitality is strong. I remember I asked a few questions about his situation. He told me that he's quite vital, he walks, etc. And I got the impression that that was quite a good case, that maybe there was some hope. Between the time they phoned me and the time they arrived, I think there was about 10 to 12 days. And he had to go to the hospital, do some workings in the hospital in America. And then he arrived with his doctor. When he arrived, I had quite a different patient. The scanning had showed 3 places in the brain where it was metastasized, and also a metastasis on the bones, which was very painful, of course, and he was under strong painkillers. The man was in agony of pain in spite of the painkillers, and he came to be seen in the clinic, in our clinic, and I saw this condition. The man was not able to sit in the chair, finally, because I saw he was agonizing with pain. He could not find a place to stay, and eventually we laid him on the bed, that we have, the examining bed, and from there was done most of the talking. He was quite exhausted, and I shall describe to you the type. This is a teaching case also for many other reasons. He came with his wife, his doctor, and I took information from every one of them. The man seems to be a very hard-working man. They call him actually a tiger in his work, a tiger. He was in the United States, coming from another country. He had been a kind of immigrant, that he was working for a big organization, and he was traveling all the time, all over the United States, and sometime back to his country, and he was on the go all the time. The energy that he was putting in all these projects that he was doing was tremendous. Constant traveling, hard worker. His doctor said that he likes very much to work, and everybody was afraid of him. Why? Because of his character. His character was kind of nasty character, you know. If somebody did not do well, I mean, you will give them hell, etc. You see, in a case like that, he comes there and he has pains. You know, this type of people, and you try to get a history now from him. And he has taken quite a lot of painkillers and agonizing. You know, this type of interview, it's, you have to imagine, and you are trembling now. You have here a man with a metastasis in the brain and a metastasis on the bones. That's a very, very good case to have. Within a few days, I mean, it was so fast, the development of this situation, because they had diagnosed him as cancer of the lungs 1 month before telephoning. In 45 days, they found already metastasis on the brain. In 45 days. It's a fast developing type of cancer. What he says in 1976, he comes in 81, that means five years ago, started having a lot of gas and indigestion and was feeling very tired. He fasted for 10 days and the indigestion subsided. He was a man that will follow righteousness. Righteousness, right? When is right? Righteousness. You don't understand. Right, air. Yes. Righteous. Isn't that? Righteous. Very impatient. And he cannot give me anything about his past history apart from that incident on 76 where he has bloatedness and indigestion and things like that. So he says, following righteousness, his doctor says, he's a man of righteous man. So what you would think with these two information, a lot of gas, indigestion and righteousness, what remedy you would think? What is? Lycopodium. Yes, you will think lycopodium. I was thinking lycopodium also. But something did not go with this. There was an element in him which was really, it was a man who wanted effect and he worked hard and he did a lot and he was aggressive. They call him tiger. So there must be a remedy, must be nux vomica. Is this nux vomica? You see, now in such a case, unless you find the right remedy, I mean, forget it. There is no possibility. The man is going to, in 10, 15 days, going to die. But even with the right remedy, perhaps. And when you give a prescription, this is the only chance that you have. It's not you give first nux vomica, then lycopodium, then another remedy, then you don't have this luxury in such a case. So I let his wife talk. And then I feel that there is a great, how can I say? Conflict. Yes, just say it more loudly so I can hear the word. Conflict. A lot of conflict and a lot of fighting in between them. Now, what is the fighting? What is the fighting about? It's about, what I ascertain it's about righteousness. You know, he says it's righteousness, but at the same time, there is an element which is very aggressive, very, how would describe? An element of kind of maliciousness, I would say, in him. It is arrogant, it is... But he's a man, as I understand, that with his wife he's fighting, you know, and gives hell. With his subordinates he's fighting, giving them hell. And he travels from one place to the other. He goes to the different organizations and talks to people and cuts people down, etc. Looks like Max Vomica. But I'm not happy with the Max Vomica. I'm not happy with the Max Vomica. So, to my understanding, there is behind something else. There is behind that case. Still, your mind has gone at all to any other remedy except of lycopodium, except of Max Vomica? Just to hear some suggestions. Very good. Who said tuberculinum? Who? Who said tuberculinum? Ah, yeah, good. Tuberculinum, yes. This, why? Why tuberculinum? What you see is a man who is quite given to his work, and he's not a man that he travels like me. Travels, he says, oh my God, I have to travel again. He travels all the time and he works. I mean, he's there. His energy is traveling. Maybe he's enjoying traveling. He's enjoying what he's doing. He's a big man now in a big organization. All the information that has to come has to be analyzed, going through your computer inside and be analyzed and taken into consideration. Now the next question you are asking, if your mind goes to tuberculinum, what will be? What will be? Past history, yes. What?
I got the feeling as well when you said tiger, that I got the feeling of restlessness. Like
Yes, very good, very good. That's the idea.
Which country was his origin?
Which country? It's Asian. Asian. You'll ask, of course, to see if there is any tuberculosis, whether in his family or in him himself. So he comes from an Asian country, from a poor country. The possibility is quite a lot. As a young boy, he might have had tuberculosis. And the question was confirmed. But he did not give it in the history, he forgot it. 8 years old, they took him to the hospital, they gave him food, etc. They gave him their different medicines, and was diagnosed tuberculosis, but it was nothing. It was a little bit that was cured. You know, this is the attitude. But for us, it's very important now to know that little history which happened at the age of 8. It's very important. So anyhow, I have here the problem. I have come to the conclusion that this tuberculinum, because of the desires and aversions also, which I would... it says desire for meat is quite strong, and for fat. Does not like sweets. Indigestion for milk. You see all these symptoms? Not really, except of the fat that gives you the possibility to confirm. Sleeps on his back, desires fish to rise, oppression on chest if he lies on any side. Better lying on back. The pain on back was better by flexing his leg towards the abdomen. He had a fear of his rival, wherever he was, that he may destroy him. And here is one what you call keynote, which puts the seal for tuberculinum. What is the question now? I put sweat. No. Yes. This tiger maybe is afraid of a cat. which he admitted, cats, disgust. Dogs, the same. Which tuberculinum has many types. Disgust or fear of cats and fear of dogs. Especially fear of cats, tremendous fear of cats, or fear, or either fear or disgust. You see now, this is a typical tuberculine case, tuberculinum case. Now, what shall I do? I have the man there, he's suffering. I mean, he's in a hotel, he's staying in an hotel, and the hotel is not a place for an American to die, in the hotel. So after all these experiences and many others, I telephoned the director of the hospital in Athens. I have a case that I would like to hospitalize. And he says, what is the case? No, first he says, George Vithoulkas, who? I said, I'm the director of the Athenian Center, from here. Oh, yes. What can I do for you? I said, I have a patient that I want to hospitalize in the hospital, and I would like to attend him, to treat with homeopathy. He has come with his doctor, and they want to be treated by homeopathy, and if that is possible, to be under your care in your department. He says, of course. What does he have? What is he suffering? I said, he's suffering, he's having cancer, which has metastasis on the brain and on the bones. I hear a big pause, He says, what are you going to do? I said, nothing, but he needs a hospital. I cannot leave him on the hotel. So, okay, bring him. I said, when? He said, now. Okay, arrange for an ambulance, and the man was immediately hospitalized. Given tuberculinum 10 m, 1 dose. Yes. Now his doctor has heard about homeopathy, but he was not conversant with what we have been doing. You see, I just gave him 1 dose of tuberculinum 10 m, and he was very anxious. So we hospitalized him, and next day I go to see him, more or less the same. Afternoon, more or less the same. The second day in the hospital, the third day, the doctor is pressing me. What do you expect? What do you expect? What do you expect? You tell me now. What you may expect from this case? As a prognosis, what can be the prognosis? What is, let's put another question. If tuberculinum acts, what can we expect to do? No, I wonder if somebody wants to speak, put up his hand. So he stands up and talks. Yes.
Alleviate.
Say that. Alleviate the pain. Yeah.
I would expect it to arrest the secondary. To arrest the more production of the secondary tumours.
Of the metastasis.
Yes.
Very good.
Stop spreading.
Very good. That's good enough. Yes? Sweating. Yes? Start feeling better himself. Yes? Well, I said what I said to his doctor. I said, if the remedy acts, I'm not sure yet, was the third day. Within 4 or 5 days, that means within another 2 days, this part of the cancer is going to be activated, while the metastasis will shrink, will go back. In which case, what shall we observe? First of all, that the cancer here in this area is going to grow. Secondly, it's going to be activated, therefore there's going to be an inflammation. If there is an inflammation, we are going to have fever. So most probably within 4 or 5 days we are going to have some fever. It was like as if I was a prophet, because the 5th day he started with fever. Once he started with fever, the pain was almost completely subsided and he stopped taking the tranquilizers. He just took an aspirin here and there. Well, the director of the hospital also, one of the directors, because there are many directors, a quite old man, you know, but in the beginning of my career in homeopathy in Greece, he had expressed, and I knew it by his contacts, very bad comments about homeopathy. And we are talking about 81, now about 12 years later. We are meeting in the case, and he's always coming with his court, you know, 4 or 5 doctors in the case, and he's watching the case. He will not touch at all the case, and then the fever comes. And then next day, the fever rises, and the man starts to go into a kind of coma. When he's at this moment, he has an X-ray where it shows the growth has become bigger. In which case we have a meeting where the director says he's going to die. I said, maybe. He said, we must give him, to my understanding, some antibiotics. I said, no, it's not necessary. It's a reaction which was expected, and his medical doctor was there to confirm, you know, yes, this is the process what Mr. Vithoulkas have told me. And this is expected, and you do not need to give any antibiotics. He says, I know you don't like chemotherapy, of course, but what about cortisone? We have to give something, we have to do something. He's going to die. I said, he will die much sooner if you give him cortisone or antibiotics. And I really believe that. Anyhow, he was a bit uneasy, you know, because he would have to sign the death certificate. And but since the American doctor was also there, you know, he kept his coolness. I mean, so he left. The progress of the patient. Fever reached 39. He complained of a discomfort in the chest where he did not have it before. The pain comes down, the pain on the bones. He has no appetite at all. He doesn't want to eat anything. He has even nausea at the smell of food. And the only thing that perhaps he wants is ice cream. What is your prescription? It's the 6th day of the treatment. No appetite, nausea from the smell of food. The only thing, desire for ice cream, not underlined here at all. This is all the information I could get. What are you going to do? Just give me some suggestions.
Wait. Nothing. Wait.
You all agree to wait? But the fever is high, the man is going down, no appetite, he doesn't want to eat. Yes, he had pains in the bones, which now has become less. It's the day where he has minimized his. I have not noticed here whether he has stopped really all major painkillers. That he was taking some medicine containing opium, I think, or.
Get any perspiration?
No perspiration yet.
Any thirst?
Any?
Thirst.
No thirst. What are you going to do?
Eupatorium perfoliatum.
I beg your pardon?
Eupatorium perfoliatum.
Eupatorium perfoliatum. Yes. Why?
Because it is a rubric desired ice cream and nausea at the smell of food, and it's the only one in both.
Very good. It's in both. Well, the question is, shall we let such a reaction follow its way, and when shall we intervene? You see, the question is, theoretically, should we intervene? That's the first question we have to answer. Should we intervene? It's the 5th day, the 6th day of the treatment. I said, to my understanding, this is what I expect. It has happened. Should I intervene with a reaction in general? And if I intervene with a reaction, what are the reasons or what the circumstances under which I shall intervene? There are two. Either the next remedy has become clear, calling for another remedy, or that the patient is going to die, really, is in great danger, then I have to intervene. These are the two conditions I should intervene. Otherwise, I should let the reaction go on. It is a very good reaction. It could not be better. It's exactly what I thought, what I described, and what has happened. Therefore, unless the remedy which comes is very clear, or unless the person is really is going to die, we should not interfere with the reaction. If we interfere, we may spoil. If we interfere correctly, we may speed up process. So there are sensitive issues involved in that case. And when you have really the case. Now what happens in this case is not now the medical doctor who is attending him only. At that day arrives from Tokyo the head of the department of the biggest hospital of Tokyo, who is connected with this organization, this man is one of the big shots, in order to overlook upon his important patients. So I have the director of the hospital, the doctor, and also the director of the Athens hospital to deal with. And to everyone I have to explain, you see, what is going on and what are you doing. And of course, when you talk to people that they don't know about homeopathy, you know, the pressure is quite strong. So I tell you that because you will find yourselves sometimes in the same situations, and you are pressed, you do something, he's dying, he's going down, he's in a coma, boo. But when you are convinced about the principle, when you're convinced what you are doing, you can resist all this pressure. You say, no, this is what we can do. We can do no more. You see, this case, it does not mean it's going to be saved with the tuberculinum or the next remedy. It does not mean. We do not know what's going to happen. So he may die. The person may die eventually. But this is a possibility for him now. A reverse process has set in motion, and there is a possibility.
Is there a possibility that the initial tuberculinum will have run out? Are there signs that you may need to repeat it, possibly in a higher potency at this stage?
Yes. Yes.
What
Yes.
would you look for?
I will look for tuberculinum acute symptomatology in such a case, like a lot of perspiration that we shall see, the desire for ice cream, which is for tuberculinum. You see here the desire for ice cream. It should not be taken as an indication of another remedy, since tuberculinum has that. You see, like the other case we saw with phosphorus, where the child develops ice cream. We don't give another dose of phosphorus because develops this. It is a proving of the remedy upon the patient, and a proof, yes, that the remedy is correct. The appearance of a new symptom that belongs to the remedy that we have prescribed, in a case that has done well under that remedy, it indicates that our prescription was right. The pain is much better, but there is a bruised feeling all over his back, a bruised feeling the next day. He was not given any medicine, and he asked for hot baths in his back, and he has developed that day a great desire for hot water or hot soup. I underline it 3 times. He had a diarrheic stool twice, and he developed a pain on the left side of chest, frontal pain. And developed a tremendous aversion to strong odors, especially perfumes. He's feeling quite cold, still the fever is high, the pains are without any tranquilizers, and just with a hot bottle he is quite comfortable. There is no perspiration. Shall we interfere? There is a great kind of exhaustion, of course, with all this situation. I mean, to see the case, now I read you the case, but to really see the case and to be there and to have all the stresses. So I have some information here. Can anybody tell what was given? Or whether should we give, or whether we should still wait, or what? Any? Time modality? No, I do not have. I could not get.
The pain wasn't very strong.
The pain, no. No. Not very strong.
And the fever was the same?
The fever was the same, yes. Around 39. The only thing is that this pain in the chest is worse if he speaks loudly. Has anybody any suggestion? Who will wait in that case? I just want to see your hands. Yes. Majority. Yes, no remedy was given. No remedy was given. The next day, we have the same symptomatology plus restlessness. The fever is 38.3 up to 38.3. It has come down a little bit. And he got a little bit warmer. He's not so cold anymore. He's restless, and he had pains during the night, and he had to take 2 aspirins. Still no remedy. Still wait. Very agonizing days, you see, where you don't know really. He feels, the next day, feels very tired. Fever still up to 38.3 is the afternoon fever. Is restless. Between 1 and 3 a.m. was coughing. And he was very restless. But his appetite is better, and he ate. He develops some thirst, underlined twice, and develops a great sensitivity to noise, underlined 3 times. Very sensitive to the smell of any type, especially perfume. And he complained he has not slept, and he was very tired in the morning when I'm going to see him.
Why did he not sleep? Was it pain?
Restlessness, he says restlessness, coughing between 1 and 3, and yeah, this is the information. Calculus. What is? For water. No, underlined twice. It is quite thirsty, but not excessive. Yes? Phosphorus?
You should still wait, because his appetite is better. And even he has something in the lung, the coffee should be a positive sign.
Yeah. How is the prognosis now state? What do we understand from his symptomatology as far as prognosis is concerned? The coughing indicates a process which is taking an action which is going on in the lungs. That he coughs between 1 and 3 a.m. 1 and 3 is the time for which remedy?
Rumex.
Which remedy?
Rumex.
Rumex, yes, but mostly is not. Rumex is? What? Spongia? What is? Arsenicum. Arsenicum and also the Calicarbonicum. You see, it says 2 to 4. Do not stick too much to it. I mean, Rumex also has that, but Rumex is another type. Here, what do we have now in this? There is a great sensitivity to perfumes and a great sensitivity to noise and sleeplessness and restlessness. And cough between 1 and 3. Which is the remedy? Now we ask, which is the remedy that causes sleeplessness, which causes this to be sensitive so much to noise and sensitive to perfumes? Calicarb. Calicarbonicum. Why don't you pronounce the Latin way? So it's international. Calicarbonicum. Calicarbonicum, yes, sure. Is this a case of Calicarbonicum now, or it is a case of so yeah, I did not hear the remedy that I gave. I gave Nux vomica. Nux vomica 30, 1 dose.
What was your criteria to fear now?
What's my theory? It is that this picture, what is giving me now, for me is quite clear for Nux vomica. Why? Why 30 potency? Yes, because I do not want really to interfere with the action, on the other hand, with the action of the 10M that I have given. You see, this is a despair prescription. The Nux vomica is given in despair. From the potency, you can see the despair. And, and also the fact that it's so close to the reaction. You see, what I expect that the person will die. I mean, will he survive this aggravation? Just to continue to give you the end of the case. The same day that was getting Nux vomica, 30, the fever in the evening reached 39, went higher. And he went through a night, 39.
Wasn't there a risk of antidote?
We'll discuss this later. He went through a night where, as he said, he had a spiritual fighting through the night. A spiritual fight. I do not know what he meant by that, but it seemed that it was a very vivid dreams on spiritual grounds. In the morning, when he wakes up, he's much more calm psychologically. He's not sensitive to either perfumes or noise. Still is very exhausted, and he is out of breath. It's dyspnea. He had a difficult breathing. Thirsty, but not as much as yesterday. Restlessness, physical restlessness is still there. Next day, he's much better all around. Got up from bed, spoke a lot. He's in good spirits, no pain, much less exhausted. And we had a good conversation, and he cracked some jokes, and also he was feeling back to himself. And he said to me that I should promise 3 things to him. The one was that I should treat a man who respected very much. He said, he named a name, this is not important now. He said, in case this happened to him, you see, you must go and treat him, wherever he is, etc. The second thing is that I should be working I should be going to America to be more in touch, more easy, accessible. And the third thing is he belonged to a spiritual kind of organization. He says, I like to convert you into this spiritual order in which I belong, you know. It's very interesting. I mean, I just give you that to give you the spirit and the relief that was there after all this ordeal. Next day, he stays better, his energy is better, he's less exhausted, more energy, good spirits, no pains, not even aspirin. His mind has become clear. You see, all this time, you could see, even before the fever, you could see that the mind was not clear. It was in a hazy state, and also a kind of imbalance that you could discern. Where now, after all this fever, you could see his mind was again working properly, where the dyspnea continues, and out of breath very easily, and then we had to take decisions. You see, the director of the hospital, of Tokyo Hospital, who said actually that their hospital is better than the American hospital, what's called this big clinic, Mayo Clinic, yeah. They said that their hospital had much more facilities, and they had much more, and the kind of hospital, you know, he did not like, though it was the best hospital in Athens, he did not like, and he had all kinds of complaints that they had no this and they have no that, technical facilities, etc. He was complaining, and after 3 days, finally, it was decided that he will take him to their hospital in Tokyo. Now the man discussed with me certain possibilities of treating further that person with, I said, with what? With chemotherapy. He said, no, we are using methods to stimulate the defense. I said, what method? You see, they inserted certain allergens that cause a reaction, and they try to bring up fever, etc., etc. I mean, I do not know whether he was telling that because he had seen what was happening, but he tried to persuade me that in their hospital they are giving this kind of treatment, which is a treatment which is accepted to certain allopathic hospitals. Some of you must be aware of that. Anyhow, I said that I would not agree, that our system was completely different. Maybe the result was the same, that was bringing up the fever, but on another level. We do not stimulate with chemicals, etc. Anyhow, there were big discussions, and they decided to leave Athens and to fly to Tokyo. The American doctor continued to accompany the man in Tokyo. He had complete trust now in homeopathy, because whatever I have said had come true, and he knew it only himself, because I spoke with him, and he had seen things happening exactly as I've told him. You know, I said, we're going to have more cancer on the lung where the brain and the bone metastasis will shrink. Eventually he flew to Tokyo, and he telephoned me from Tokyo, and he says, we arrived in Tokyo, no problem, his energy is very good. He flew for 20 hours from Athens to Tokyo without any problem. He says, it was great, etc. And next day he will inform me about the case. where the pressers started in Tokyo going to start the treatment. They wanted my consent, you know, from Tokyo. So the man was in between, you know, the doctor was in between. So he, at a certain moment, he said to me, I mean, it's very difficult because I was trying to get reports from him to see if another remedy is appearing or where to find the remedy, and I could not find remedies in Tokyo. And I had a lot of problems. He says, it's better if you allow them to continue the treatment. So after about 15 or 20 days of come and going, you know, to telephone calls from Tokyo and Athens, I said, okay, let them proceed, you know, see what happens. The man was in very good condition all this time, you know. 15 days after, in about 20 days he died after the treatment. Well, I do not maintain that it would have been saved by our treatment, but definitely it showed to me, and this is one of the cases that I have seen again and again, what are the possibilities that we have with homeopathy, with the right type of homeopathy. Yes?
Why did he choose to go to Tokyo when he was getting better?
You didn't hear the story? There is a man, the director of the hospital. The hospital belongs to the man. You know, it's his own hospital. They have a hospital where they will treat him like a king. You know, and here he is in Athens. They don't like the situation. They don't feel comfortable. The director has come to fetch him and take him back there. Do you think that it was easy to keep this situation there? It was very difficult.
What is your interpretation of his response, and what sort of conjectures do you make about what was going on?
Yes. What are the possibilities in such a case are that the cancer will develop more and more in the lung, and most probably he will live 1 year, 1.5 years, and he will die from hemorrhage, profuse hemorrhage, that at a certain point most probably will happen in the cancer from the lung. That is the most I could go as far as prognosis is concerned with such a case. Yes?
Do you think the aggravation produced by a remedy in a situation like that could be fatal? You've talked yesterday about spoiling cases and producing aggravations. And in that sense, in what way would you distinguish it from the risks involved in conventional treatment? And as a tail end to that, you mentioned yesterday using low potencies where there was marked organic pathology. Why did you use a 10M of tugboat?
I did not hear very well the question, but I heard, why did I use 10M where there is a possibility to have a big aggravation and the person may die? Is that your question?
Yeah, basically, can you kill someone with an aggravation?
Yes.
Are we entitled to separate so clearly the risks of allopathic treatment and homeopathic treatment?
Yes.
If homeopathy is capable of speeding someone's demise?
Yes. Yes, that's a good question. Whether we are entitled to take a person through an aggravation that may be fatal. I have not seen yet a case that under the right homeopathic treatment went through an aggravation, went into an aggravation and that aggravation was fatal. I have been practicing and for the last 20-25 years I have seen more cases than anybody else in the world has ever seen because of working with so many doctors in the clinic, and I still have not seen a case where the aggravation was fatal. On the contrary, I have seen that if there is an aggravation, always there is a possibility of cure. If we have a real aggravation, I do not mean aggravation the continuation of a situation going worse and worse without the remedy having affected the case. Because sometimes we may consider that as an aggravation, a homeopathic aggravation, which is not. We have given the wrong remedy and simply the disease progresses towards termination. This is not an aggravation. Aggravation has certain parameters on which you can rely, and you can say, this, we have now a homeopathic aggravation. Under such an aggravation, I have not seen a fatal termination. I have seen, though, that many times I had to interfere with another remedy during what we call the aggravation period. I do not know what would have happened if I had left the patient without the help of the second remedy or of the third remedy. But I still have to see a case where went through an aggravation and because of the aggravation he terminated. Whenever I see an aggravation, I see a possibility of a cure. Incurable cases do not have the possibility of an aggravation. You see immediate amelioration, a little bit better. Now this man, a little bit better in his pains, would mean nothing. Would mean either the remedy was wrong or the cure was impossible. Yes?
Would you happen to know the findings, the autopsy findings in that case? Were you informed perhaps of any autopsy findings in relationship to the primary and relationship to the metastatic?
Has anybody heard, so we can repeat?
I was wondering if you got an autopsy report at the end. Did you get an autopsy report?
No, I did not. But I did not get an autopsy report from, that would be interesting to see what happened. But they applied their methods of treatment, which does not really give us the possibility to see what we have done only through homeopathy. If he had terminated under homeopathy, we could have this result, or we could have we know very well what is the condition that will happen with under homeopathic treatment. You see, at this moment, I'll give you another case. At this moment, I have my uncle, the brother of my mother. Last November or October, last October, he was diagnosed as having cancer of the lung on the left apex. And at the same time, a friend of mine had his brother in New York. He telephones me, he says, my brother has cancer on the left lung. And he's thinking of coming to you, etc. I said, because he was a friend of mine, I said, maybe he has a possibility. Anyhow, the doctors from New York persuaded him that they could manage. And they would give treatment that this starting of the cancer would definitely disappear. My uncle, who does not know he has cancer, of course, but his daughter and his children decided that he should come for homeopathic treatment. He is under homeopathic treatment. Now, what is the observation? I'm just giving you these examples because they have just happened at the same time. Of course, we do not know the type of cancer because it was not allowed to take I did not want to take an biopsy. I do not want to touch at all the whole situation. Now, what has happened in two cases? The one case in New York, he was given heavy chemotherapy that took away immediately, within 15 days, took away the lesion. And X-ray wise, the lung was clear. In 1 month, we're talking about December now, last year, there was a metastasis on the brain. January, there's a metastasis on the bone. I mean, they irradiated the brain in order to prevent metastasis and the idea was, let's do it quickly to prevent metastasis on the brain. and then radiate this to prevent metastasis on the bones. The fact remained, because I was getting all the report through his brother, through the telephone calls, the fact remained that he had a metastasis on the brain, he had hemiplegia, he had metastasis on the bones, and end of February, he terminated. My uncle, whom I wanted to take him on video just before coming, but I brought my leg, they were all too difficult to arrange. I just wanted to show you the X-ray and at the same time the man on video. Now the man the man in New York is under 60, is 57. My uncle is 75. What we see X-ray wise in my uncle, and I have this, we will see a growing of the tumor in the lung where it occupies the whole left lung now. But my uncle has a good appetite, eats well, does everything because he lives alone in the house. He goes every evening out with his friends. He lives a normal life, and there were only the beginning where it was spitting blood, pieces of blood, and that was ended within a few days. And since then had no other spitting of blood. There were 2 times where they started a tremendous whistling, very tremendous whistling, which was taken away by Kali carbonicum. My uncle, as a constitutional remedy, is Kali carbonicum, and Kali carbonicum has acted every time that there was a kind of relapse. Anyhow, the X-rays said tremendous explosion. But the man, I said to him, do you feel anything? No. You understand? No, he feels he was well. He feels he's well with one lung. It's like as if he has a pneumothorax, you see? You know, the pneumothorax, what they do? They paralyze one, they stop one lung from working, and the people who works with other lung. There is not even dyspnea. Now, do I expect that he's going to live another 5 years? No. But if we take the comparison of the 2 people, one died in a turmoil. I mean, you cannot imagine the odyssey that he went through, because I knew the case all the time through the telephone. Should they come or not to me? Well, I avoided the case once the chemotherapy has started, because we have no chance after that. There is some chance before the chemotherapy starts, but we cannot go out and say, hey, come here, we'll treat cancer. No. We have to see again and again such cases, and then at that moment, a certain moment, it has to be decided by the official medicine that, okay, you come here and we have a double-blind study and we see what you can do in cancer. Then we can publish and we can say results. What I'm telling you now are cases, as you will see. Also, my father-in-law, if I have time to give you, with acute myelogenic leukemia. You will see the case. But this is my father-in-law that I apply. It is my mother's brother whom I apply homeopathy. You see, I cannot go out and say, okay, whoever comes have cancer, come to me. They will cut my throat very soon. Yes?
Yesterday, you spoke about having the correct constitutional remedy, and yet the person not responding, perhaps the organ was degenerated too much. Is it possible to have the correct constitutional remedy, and yet, because the person does not want to be well or get well, you cannot force them against their free will?
Yes. It is a situation which I cannot answer, because I'm not sure in such situation whether I have the right remedy. I have seen people coming with the idea, you see, I don't want to be, you see, my daughter brought me here, I don't want to come to the doctor. why they have brought me here, you see? I've seen this happening, and with the right remedy, they change, and they say, oh, please help me. But I cannot be sure in a case where somebody, there is some reasons, you know, that, how do we know that we had the remedy? All these are questions. Yes?
Last year I was speaking to Roger about treating cancer cases, and he said that the way he understood it was to look at the local symptomatology of the cancer, what was happening as top layer more, and the acute phase, and treat that unless the constitutional picture comes up very strongly.
There's no difference. You see, when we have a case, another case, we'll show one remedy first, and a second remedy, and then the third remedy that will go deeper. It might be that it's not always that the constitutional remedy, that remedy that appears to be deep, because in these cases we cannot see. You see, in my father's cases, my father-in-law case, you will see different remedies given before the remedy has acted.
Do you think the fact that your father-in-law was treated with non-invasive methods and also not told about his disease in terms of its pathology and its outcome had any bearing on his survival instead?
You see, I don't think cancer spares anybody, and never mind the attitude. I don't believe that the attitude can stop the development of cancer. I don't believe. Maybe I'm right, I'm wrong.
Why did you not then tell your father-in-law?
It's not told. Anybody, nobody in Greece is told that they are having cancer. This is the general practice. They are sentimental people, emotional people, that may. And I know a case of a professor of internal medicine with cancer of the colon that he was shown his own x-rays, and his assistant was able to persuade him that was a polypus. Until the day he died. I mean, he was completely, professor of general medicine, and was a very good professor. And he would see this, but this is polypus. Yes, right, and continue. I see that's a practice. Somebody?
The case that you just gave us now, this patient was heavily tranquilized by painkillers, but still the tuberculinum active. Is that for the same reason that you gave us yesterday, that you can, for instance, coffee will not antidote the true constitutional remedy?
Yes. Because after all, within 3-4 days, the remedies were discontinued. If he had to take these medicines for 1 month, 2 months, maybe would antidote, yes. But for these first 3 days, the remedy goes through in spite of the dragging.
I want to try to ask you a question about surgery. Do you consider surgery necessary in, for instance, congenital heart cases?
Oh yes, absolutely. Yeah.
Can you please insist that questioners do stand up so that we can hear the question properly?
Yes. The question that was asked, whether in congenital heart diseases would I recommend surgery, I said yes, absolutely. Yes.
One thing I'd still like a little bit of guidance on is whether you feel that what are the risks, if any, of bad homeopathy. You've described your own experience as an expert. How do you feel about it in the hands of people without that degree of knowledge? If you wish to apply it to someone with cancer, okay, or you perhaps could comment in a general way.
Still, I do not grasp the question.
Are there any risks?
Yes.
From bad homeopathy?
From bad homeopathy?
Yeah.
If there are any risks, yes. Yes. Yeah, that's a simple question. I understand. The risks which are from bad homeopathy are that the progress of the disease can continue, and if the person is not told what are the risks, that he may go into a state where it's much worse than when he came to homeopathy. That means we let his progress go on without applying some other measures that supposed to have stopped that progress. That is a risk, yes. Whether we say that to the patient or not, the practice of our center is to tell that to the patient and to let the patient decide for himself whether he would like to have a trial period, and we define the trial period depending on the severity of the case as 1 month, 2 month or 3 month period. Usually is between 1 month and 3 months, where he would agree to have a trial period, and if homeopathy would work, then he can continue. If it does not work within that time, then he may stop and fall back to his normal treatment. Is this clear? Yes?
In general, would you stop things like cortisone before treating someone?
Cortisone is a remedy that is a drug which is very powerful and does not allow the action of the homeopathic remedy, but to a very short term. That means for a few days. If a person is taking cortisone and high doses of cortisone for a long period of time, that means for 1 year and 1 year and a half, 2 years, we do not suppose, they do not want to stop the taking of the cortisone in such a case. But if the person has recently started on cortisone, and depending on what type of cortisone, because it's the longer acting cortisone which we don't talk about, then depending on the case, we may decide to stop the cortisone and apply the treatment. But I have done it once with somebody who was under cortisone in a severe asthma condition, and it took me a very long time, about 4 years, before I could get him out and get him well with his asthma. Where if that person was not under cortisone, his treatment would have taken 1 year or 2 years, half of the time. Yes?
I am not sure why is it that at the mode of administration, what is called pressing in homeopathy, it has not been in vogue or practiced very much. Because in the later years of Hahnemann's life, he said that in order to obtain a rapid, gentle cure, he realized after 5 years of experience that his latest method of administration of pressing, giving the remedies in solution, and increasing the potency by solutions every day. One can give these remedies daily, repeatedly, and for months. Not only in chronic cases, of course, not only in acute cases, but chronic cases. So why is it that this is not being practiced very much? So that's the one question.
I have a problem understanding your... No, I have the problem understanding the whole argument. Could somebody repeat?
I will say it again. Why is this not being used more often? For example, in your book, Science of Homeopathy, you only give a few lines. Although even the Hahnemann said we should, to the distilled water, add alcohol or charcoal. And you only mentioned just distilled water. But
there is just a moment. What did you say lately? That Hahnemann said...
administration is not being used very much.
Could you come closer? Could you come here and speak to
Can I explain?
Yeah, okay.
What I was trying to say, which is that...
Could you, Robert, could you please get up so everybody can hear?
Manu is trying to ask you why we do not apply homeopathic remedies in the way that Hahnemann describes in the last edition of the Organon, which applies only to the LM potency.
Exactly.
And
this is the answer. You said it again.
This Hahnemann talks about the LM potencies, repeating the potencies that have been prepared in a special way, which they call the LM potencies, is 1 to 50,000. He devised a kind of different potentization, different analogies in the potentization, and he found out that this medicine was more mild and this kind of potencies could be repeated. We are dealing with only, unfortunately, I do not have the experience of LM potencies, and I cannot give you any information because we have been dealing only with the centesimal potencies, 1 to 100, and this is the experience we have with these potencies. We do not have experience with LM potencies. I hope one day there is in my mind to examine the possibility of giving these potencies in repeated doses, and I shall report the results. But so far I have no experience.